Vasodilators are substances that have the ability to dilate blood vessels, increasing blood flow and consequently improving muscle oxygenation. This improvement in oxygenation is crucial for athletes and individuals practicing physical activities, as oxygen is essential for energy production during exercise. In the sports context, adequate muscle oxygenation can significantly contribute to the athlete's performance and recovery. Therefore, understanding how vasodilators work and how they can benefit muscle oxygenation is crucial for optimizing results in training and competitions. By closely following the video on vasodilators on the Gigantic Supplements channel, it will be possible to better understand how these substances function in the body and how they can positively impact sports performance. The thorough explanation of the mechanisms of action of vasodilators will allow viewers to absorb essential knowledge to enhance their training and achieve their athletic goals more effectively. The importance of paying attention to every detail of the video lies in the fact that muscle oxygenation is a fundamental aspect for endurance, strength, and muscle recovery. Understanding how vasodilators can contribute to this process is crucial for maximizing the benefits of physical training. Additionally, proper muscle oxygenation can reduce fatigue during exercise, prolonging the ability to perform intense efforts and improving training efficiency. In the sports field, the search for strategies that optimize muscle oxygenation is constant, and vasodilators represent an important tool in this context. Through the Gigantic Supplements video, viewers will have the opportunity to delve into this topic and acquire valuable knowledge to enhance their sports practice. Understanding how these substances can directly influence the body's ability to transport oxygen to the muscles is essential for athletes seeking to improve their performance safely and effectively. In summary, paying attention to the details presented in the video about vasodilators is fundamental to understand the importance of these substances in improving muscle oxygenation. The ability to dilate blood vessels and increase blood flow to the muscles plays a crucial role in sports performance and post-workout recovery. Therefore, closely following the information provided in the Gigantic Supplements video can be a significant step for those seeking to enhance their sports practice and maximize their results. Vasodilators are substances that play a crucial role in improving muscle oxygenation. By dilating blood vessels, these compounds increase blood flow to the muscles, resulting in better delivery of oxygen and essential nutrients. This enhanced oxygenation is essential for physical performance, as oxygen is needed for energy production during muscle activity. When muscles receive more oxygen, their ability to perform intense and prolonged efforts increases significantly. The improvement in muscle oxygenation provided by vasodilators has direct impacts on endurance and muscle recovery. During exercise, the demand for oxygen in the muscles increases, and the ability to efficiently supply this oxygen can determine fatigue and athlete performance. With the help of vasodilators, muscles receive more oxygen, which can delay muscle fatigue and allow for more intense and prolonged training. In addition to improving muscle oxygenation during exercise, vasodilators also play an important role in post-workout recovery. After intense training, muscles need oxygen and nutrients to recover properly. Vasodilators assist in this process by increasing blood flow to the muscles, accelerating the removal of harmful metabolites, and promoting the delivery of essential nutrients for muscle repair and growth. The ability of vasodilators to improve muscle oxygenation not only benefits elite athletes, but can also be advantageous for individuals seeking to improve their health and fitness. Adequate muscle oxygenation not only enhances sports performance, but also contributes to cardiovascular health and overall muscle function. Therefore, the proper use of vasodilators can be beneficial for a wide range of people looking to optimize their workouts and promote more effective recovery. It is important to emphasize that while vasodilators can offer significant benefits for muscle oxygenation, their use should be approached with caution and following appropriate guidelines. It is essential to consult a healthcare professional or sports nutrition specialist before starting any supplementation with vasodilators to ensure that it is safe and suitable for individual needs. Additionally, it is crucial to choose quality and reliable products to obtain the desired benefits without compromising health. In summary, vasodilators play a fundamental role in improving muscle oxygenation, benefiting both athletes and individuals seeking to improve their fitness. By increasing blood flow to the muscles, these substances promote more efficient delivery of oxygen and nutrients, contributing to sports performance, post-workout recovery, and overall muscle health. Vasodilators play a crucial role in improving muscle oxygenation. These compounds act directly on blood vessels, promoting the relaxation of vascular walls and, consequently, increasing vessel diameter. This process is known as vasodilation. When blood vessels dilate, there is a reduction in resistance to blood flow. This allows a greater volume of blood to flow through the vessels, facilitating the transport of oxygen and essential nutrients to the muscles. Muscle oxygenation is crucial for physical performance, whether during exercise or daily activities. Muscles depend on an adequate supply of oxygen to produce energy through the process of cellular respiration. During exercise, the demand for oxygen in the muscles increases significantly. In these situations, vasodilators play a crucial role, allowing more oxygen-rich blood to reach the active muscles. One of the main vasodilators is nitric oxide, NO. This compound is naturally produced by the body and acts as a chemical messenger, signaling blood vessel dilation. Nitric oxide is synthesized from an amino acid called L-arginine, found in various foods. L-arginine supplements can increase nitric oxide production, improving vasodilation and, consequently, muscle oxygenation. In addition to nitric oxide, there are other compounds that act as vasodilators, such as bradykinin, histamine, and the end products of the prostaglandin pathway. These compounds interact with specific receptors on vascular smooth muscle cells, promoting vessel relaxation and dilation. The vasodilation induced by these compounds is essential to ensure an adequate supply of oxygen and nutrients to the muscles during intense physical exercise. Without good muscle oxygenation, muscles quickly fatigue and physical performance is compromised. Furthermore, vasodilation also plays an important role in removing metabolic waste products, such as carbon dioxide and lactic acid, produced during intense muscle activity. Adequate blood flow facilitates the removal of these waste products, reducing muscle fatigue. Vasodilators are also relevant for muscle recovery after exercise. During the recovery phase, muscles need an adequate supply of oxygen and nutrients to repair tissue damage and replenish glycogen stores. Some nutritional supplements and natural compounds are known for their vasodilatory properties, such as grapeseed extract, pine bark extract, quercetin, curcumin, and resveratrol. These compounds can contribute to improving muscle oxygenation and physical performance. However, it is important to note that the effects of vasodilators may vary from person to person, depending on factors such as age, physical condition, and possible interactions with other supplements or medications. In addition to vasodilators, other strategies can also be adopted to improve muscle oxygenation, such as regular cardiovascular training, which strengthens the cardiovascular system and increases oxygen transport capacity. Adequate hydration is also crucial, as significant dehydration can compromise blood volume and, consequently, the ability to distribute oxygen to the muscles. Practicing warm-up exercises before intense physical activities can also contribute to improving muscle oxygenation, preparing the body for increased oxygen demand during exertion. Vasodilators not only improve muscle oxygenation, but also play a crucial role in regulating blood pressure. By promoting the relaxation of vascular walls, vasodilators reduce resistance to blood flow, decreasing blood pressure. This action is especially beneficial for individuals with high blood pressure, as reducing blood pressure lowers the risk of cardiovascular complications, such as stroke and heart failure. Furthermore, vasodilators are also important for healthy vascular function. By promoting the relaxation of vascular walls, they contribute to maintaining the elasticity and flexibility of blood vessels, preventing stiffening and the formation of atheroma plaques. It is important to emphasize that vasodilators do not act alone in the body. They are part of a complex system of blood flow regulation, interacting with other mechanisms, such as vasoconstrictors, which promote narrowing of blood vessels. The balance between vasodilators and vasoconstrictors is crucial for maintaining vascular homeostasis and ensuring an adequate supply of oxygen and nutrients to all tissues of the body. Some factors may negatively influence the action of vasodilators, such as oxidative stress, chronic inflammation, and certain lifestyle habits, such as smoking and physical inactivity. Oxidative stress, caused by an excess of free radicals in the body, can inactivate nitric oxide molecules, reducing their vasodilatory capacity. Therefore, The intake of antioxidants is recommended to combat oxidative stress and preserve vasodilatory function. Chronic inflammation can also impair the action of vasodilators. Inflammatory cytokines, such as interleukin-6 and tumor necrosis factor alpha, can interfere with the synthesis and action of nitric oxide, making vasodilation difficult. Smoking is another factor that compromises vasodilator function. Exposure to cigarette smoke can damage the inner lining of blood vessels, known as the endothelium, reducing nitric oxide production and increasing the risk of cardiovascular diseases. Regular physical exercise, on the other hand, can improve vasodilator function. Exercise promotes the synthesis of nitric oxide and other vasodilators, as well as reducing oxidative stress and chronic inflammation. In addition to the benefits for muscle oxygenation, vasodilators also play an important role in male sexual function. Nitric oxide is crucial for penile erection, as it promotes relaxation of the blood vessel walls in the penis, allowing blood influx and tumescence. Disorders in nitric oxide production or action can result in erectile dysfunction. In such cases, medications that increase nitric oxide levels, such as phosphodiesterase 5 inhibitors, are commonly prescribed for the treatment of erectile dysfunction. Vasodilators are also studied as potential therapies for neurological conditions, such as stroke. By improving blood flow to the brain, vasodilators may help reduce damage caused by cerebral ischemia and promote neurological recovery. Some chronic diseases, such as diabetes mellitus, can affect vasodilator function. Chronic hyperglycemia can damage the vascular endothelium and reduce nitric oxide production, increasing the risk of vascular complications. In these conditions, strict control of blood glucose levels and the use of adjunctive therapies, such as L-arginine supplements or antioxidants, may help improve vasodilator function and prevent complications related to poor tissue oxygenation. Vasodilators also play a crucial role in regulating body temperature. By promoting dilation of blood vessels in the skin, they facilitate heat dissipation through increased blood flow to the body's surface. This ability to control body temperature is especially important during intense physical exercise, when heat production by the body increases significantly. Vasodilators help prevent overheating and heat exhaustion. Furthermore, vasodilators are also studied as potential therapies for conditions related to poor blood circulation, such as peripheral arterial disease. This condition is characterized by narrowing of the arteries that supply blood to the extremities, such as the legs. By promoting vasodilation, these compounds can improve blood flow to the affected extremities, relieving symptoms of pain, tingling, and intermittent claudication, common in peripheral arterial disease. Some vasodilators are also used in the treatment of migraine attacks. During a migraine attack, there is intense vasoconstriction of the cerebral blood vessels, causing severe pain. Triptans, a class of vasodilator medications, act by relaxing these vessels and relieving pain. It is important to note that the use of vasodilators should be done with caution and under proper guidance, as some of these compounds may interact with other medications or cause unwanted side effects in certain individuals. For example, some vasodilators may cause hypotension, excessive drop in blood pressure, in patients who already have low blood pressure or are taking other antihypertensive medications. Additionally, certain vasodilators may be contraindicated in patients with severe heart failure or other cardiovascular conditions, as they may overload the heart and worsen symptoms. It is essential for individuals with pre-existing health conditions to consult a healthcare professional before starting the use of any vasodilator-based supplement or medication. Although vasodilators are widely studied and used in various clinical conditions, there are still gaps in knowledge about their complex mechanisms of action and potential interactions with other physiological factors. Continued research is needed to better understand the role of vasodilators in muscle oxygenation, as well as to explore new therapeutic approaches based on these compounds. In addition to the benefits for muscle oxygenation and the functioning of various body systems, vasodilators are also fundamental for the proper functioning of other systems of the human body, such as the cardiovascular, respiratory, and renal systems. In the cardiovascular system, vasodilators regulate blood pressure, facilitate blood flow to vital organs, and prevent the accumulation of atheroma plaques in arteries, reducing the risk of heart disease. In the respiratory system, vasodilators play a crucial role in regulating blood flow to the lungs, facilitating gas exchange and blood oxygenation. In the renal system, vasodilators regulate blood flow to the kidneys, allowing adequate blood filtration and elimination of metabolic waste products. This vasodilatory action is particularly important in situations of renovascular hypertension, a condition characterized by narrowing of the renal arteries, which can lead to high blood pressure and kidney damage. In addition to the benefits for muscle oxygenation and the functioning of various body systems, vasodilators are also studied as potential therapies for other conditions, such as Alzheimer's disease and glaucoma. In Alzheimer's disease, vasodilators may improve cerebral blood flow, providing more oxygen and nutrients to nerve cells and possibly slowing the progression of the disease. In glaucoma, a condition characterized by increased intraocular pressure, vasodilators can help reduce this pressure, improving blood flow and nutrition to the optic nerve. Although vasodilators are widely used and studied, it is important to remember that they are not the only solution for improving muscle oxygenation and physical performance. A multifaceted approach, combining the proper use of vasodilators with a balanced diet, adequate hydration, regular physical training, and healthy lifestyle habits, is essential to maximize benefits and minimize risks. Additionally, it is crucial to emphasize the importance of following the guidance and recommendations of qualified healthcare professionals when considering the use of vasodilators or any other supplement or medication. Vasodilators may also be useful in situations of tissue ischemia, when the supply of oxygen and nutrients to a tissue or organ is compromised due to blockage or narrowing of blood vessels. In these situations, vasodilators can help restore blood flow, improving oxygenation and nutrition of the affected tissues, thus reducing damage caused by ischemia. This application is particularly relevant in the treatment of conditions such as myocardial infarction and ischemic stroke, where rapid restoration of blood flow is crucial to limit tissue damage. In addition to directly improving blood flow, vasodilators can also exert beneficial indirect effects on muscle oxygenation by modulating other physiological processes. In conclusion, vasodilators play a crucial role in improving muscular oxygenation, allowing muscles to receive an adequate supply of oxygen and nutrients during physical exercise and other intense activities. These compounds promote the relaxation of blood vessel walls, increasing blood flow and facilitating the transport of oxygen to active muscles. There are several classes of vasodilators, each with its unique mechanism of action, including nitrate derivatives, calcium channel blockers, and natural substances like arginine. In addition to directly improving muscular oxygenation, vasodilators can also have additional beneficial effects, such as reducing oxidative stress and inflammation, which can compromise muscular performance. They are also useful in the treatment of cardiovascular diseases, such as hypertension and coronary artery disease, which can indirectly affect oxygen supply to the muscles. However, it is important to remember that vasodilators should be used with caution and under proper guidance, as they can have side effects and drug interactions. Non-pharmacological strategies, such as regular aerobic training, intermittent hypoxia, and massage techniques, can be combined with vasodilators to enhance their effects on improving muscular oxygenation. If you are interested in enhancing your physical performance and improving muscular oxygenation, be sure to like this video and subscribe to Gigantic Supplements channel to receive more valuable information about health, nutrition, and supplementation.